Hi, and welcome to another presentation in my series, Medication Class, The Pivot Perspective. Here's a necessary legal disclaimer. Dietary supplements are not evaluated by the FDA and are not intended to diagnose, treat, cure, or prevent any disease. Always consult with your own healthcare provider before changing any of your medications or starting a dietary supplement. This presentation and other information on my website are for information and educational purposes and should be independently verified and assessed before making any personal healthcare decisions. Hello, my name is Dr. Amy Naprick. I am the founder and CEO of Pivot Integrative Consulting. I'm a Doctor of Pharmacy graduate from Creighton University School of Pharmacy and Health Professions, licensed to practice in the Carolinas and Georgia. I'm proud to say I became board certified in lifestyle medicine last year, and as a diplomate from the American College of Lifestyle Medicine, I'm excited to share this information with you. I'm also an integrative pharmacy specialist, which just means I've been trained. Today, we are going to talk about high blood pressure medications and micronutrient depletions. Our objectives today are to answer the following questions. What is blood pressure? What are the different types of medications used to treat blood pressure? What micronutrients can blood pressure medications deplete? How can we use food to help control blood pressure? What is the DASH diet? And where can you find more information? Let's start with the basics about blood pressure. Okay, so you get your blood pressure checked at your doctor's appointments or at the pharmacy, and you get a number like 120/80. But what do those numbers actually mean? If you ever took an anatomy class, you might remember that the heart has 4 chambers. The 2 on the top of the heart are the atria, and the 2 on the bottom are the ventricles. The ventricles are powerful pumps that move the blood throughout the body. When measuring the blood pressure, the systolic, which is the top number, is the pressure to pump blood out of the heart to the rest of the body. The diastolic, the bottom number, is when the ventricles of the heart are resting or filling. If the bottom number is high, that means there is an additional strain on the heart muscle when it is supposed to be at rest. According to the American College of Cardiology and the American Heart Association hypertension guidelines, a normal blood pressure for an adult is less than 120 systolic and less than 80 diastolic. Elevated blood pressure is 120 to 129 systolic and less than 180 diastolic. Stage 1 hypertension is 130 to 139 systolic or 80 to 89 diastolic. And stage 2 hypertension is greater than 140 systolic or greater than 90 diastolic. A diagnosis of stage 1 or stage 2 hypertension cannot be made with just one blood pressure reading. 2 blood pressure readings must show a high reading on 2 separate occasions in order to diagnose hypertension. Sometimes, anxiety about visiting a doctor's office can make your blood pressure increase. This is called white coat hypertension or white coat syndrome. If you have white coat syndrome, it's a good idea to get an automatic blood pressure monitor and keep a journal at home of your blood pressure readings to get a more accurate picture of your blood pressure. Here's a tip. The automatic blood pressure monitors on the arm are more accurate than the ones designed for the wrist. To ensure accuracy, make sure the cuff is the right size for you. When checking the blood pressure, make sure you are in a seated position with feet on the floor and rest for about 5 minutes prior to taking the measurement. Place your arm, preferably the left, at the level of your heart or chest. Stay still and do not talk while measuring your blood pressure. Measure your blood pressure at the same time each day and keep a log. The best times are in the morning, right after you wake up, or in the evening, right before you go to bed. There are different types of medications that can be used to control blood pressure. Since these medications work in different ways, it is common for a person to be on more than one medication to help control their blood pressure. Here's a brief overview of blood pressure medications. I plan to go into more detail on this first group of hypertension medications in another presentation, but it is necessary to include them because they are a common therapy choice for treating high blood pressure. These are the diuretics, otherwise known as the water pills. There are the thiazide diuretics, chlorothalidone, hydrochlorothiazide, also known as HCTZ because that's a really long word to say, chlorothiazide, indapamide, and metolazone. The loop diuretics, furosemide, bumetanide, and torsemide. Potassium-sparing diuretics, amiloride, triamterene, and the combinations with hydrochlorothiazide. And the mineral corticoid receptor antagonists, the eplerenone and spironolactone. Again, I will detail these more in another presentation, but the basic mechanism is that the blood pressure is decreased by reducing volume. Kind of like if you take water out of a pipe, there's not much pressure. And so these make the reduction in volume by making you pee a lot. So these are best taken in the morning, so you're not up all night running to the bathroom. Next, we have our ACE inhibitors and ARBs, so the angiotensin converting enzyme inhibitors and angiotensin receptor blockers. ACE inhibitors end in pril and are benazepril, captopril, enalapril, lisinopril, and ramipril. The ARBs end in sartan and are candesartan, irbesartan, losartan, olmesartan, and valsartan. Sometimes these medications are combined with the diuretics into one tablet to reduce the number of medications a person would have to take each day. In order to understand how these medications work, it is important to talk about the RAS system, or the renin-angiotensin-aldosterone system. In response to low blood pressure, your kidneys release an enzyme called renin, and the liver produces a protein called angiotensinogen. The renin causes a reaction to transform angiotensinogen into angiotensin 1. Then, in the lungs, the angiotensin converting enzyme converts angiotensin 1 to the active hormone angiotensin 2. One of the ways angiotensin 2 increases blood pressure is by constricting blood vessels throughout the body by triggering the release of aldosterone. Angiotensin 2 also acts in the kidneys to change electrolyte and fluid balances to increase blood pressure. So, in order to lower blood pressure, ACE inhibitors prevent the conversion of angiotensin 1 to angiotensin 2. And ARBs block the angiotensin 2 receptors so it cannot constrict the blood vessels, release aldosterone, and other cascading factors to raise blood pressure. Some common side effects with ACE inhibitors include a dry cough, hyperkalemia, which is increased potassium levels in the blood, and fatigue. A rare but serious side effect is angioedema, which is swelling in the lips, face, or throat. It could happen at any time, and you can take the medication for years with no issues. But if you experience any facial swelling after starting an ACE inhibitor, please contact your healthcare provider immediately. If a patient has experienced a dry cough with ACE inhibitors, they will often be switched to an angiotensin 2 receptor blocker. So common side effects with ARBs include hyperkalemia, which is that increased potassium level in the blood, and dizziness. Angioedema, while still rare, can also occur with ARBs, so caution is recommended if someone has already had angioedema with ACE inhibitors. ARBs may not be their best choice to control blood pressure. Now, let's talk about calcium channel blockers. Calcium moves through channels in the heart and the blood vessels to cause a contraction. By blocking these channels, we can dilate the blood vessels and slow the heart rate to allow more blood to enter the ventricle before being pumped out. By slowing the heart rate and dilating the blood vessels, blood pressure will decrease. The dihydropyridines work on the blood vessels. Those include amlodipine, felodipine, and nifedipine. The non-dihydropyridines work directly on the heart muscle, which includes diltiazem and verapamil. Some side effects for calcium channel blockers include swelling, especially in the lower legs and ankles, dizziness and fatigue, nausea, constipation, and heartburn, as well as facial flushing. Let's talk about beta blockers. We have the cardioselective beta blockers that work on the beta receptors in the heart. Those include atenolol, bisoprolol, metoprolol tartrate, and extended-release succinate, and nebivolol, which is also known as Bistolic. Non-selective beta blockers are nadolol, propranolol, and timolol. There are also some mixed alpha and beta blockers, carvedilol and labetalol. The locations of the beta receptors that these medications block can determine potential side effects for these agents. This diagram is a very comprehensive look at the beta receptors in the body. It is important to note that beta-1 receptors are primarily in the heart and kidneys. The cardioselective agents can block these receptors. The beta-2 receptors are in the lungs as well as smooth muscle in other areas of the body. So the non-selective beta blockers can also block these receptors. If someone has a respiratory disease such as asthma or COPD, the non-selective agents would not be recommended because blocking the beta-2 receptors in the lungs can lead to trouble breathing. There are also beta-3 receptors in the adipose or fat tissue, and they play a role in the breakdown of fats. Some side effects of beta blockers include slowed heartbeat, depression, and fatigue, cold hands and feet, shortness of breath, especially in the non-cardio-specific beta blockers, and GI effects like nausea, diarrhea, or constipation. Beta blockers can also hide the signs of low blood sugar in people with diabetes. The only sign of low blood sugar that is not hidden is sweating. Some other medications used to control blood pressure include alpha-1 blockers, which are doxazosin, prazosin, and tirazosin, the direct renin inhibitor aliskiren, centrally acting alpha-2 agonists, clonidine and methyldopa, and direct arterial vasodilators, minoxidil and hydralazine. Let's talk about some of the micronutrients that blood pressure medications can deplete. ACE inhibitors can deplete zinc. Zinc is great for our immune system by helping to produce antibodies. Zinc also helps our body with metabolism, wound healing, and our sense of taste and smell. Zinc also promotes cardiovascular health, so depletion of zinc by ACE inhibitors can potentially raise blood pressure. Low zinc levels may lead to an increase in head colds and other respiratory infections, delayed wound healing, blurred vision, appetite changes, and unexplained weight loss, as well as mood changes such as irritability and depression. Low zinc can also manifest as hair loss, although too much zinc can be just as bad for the hair. A person with a zinc deficiency may also have an altered sense of smell and taste, as well as brain fog. Some foods that are high in zinc include animal-based foods like oysters, chicken, grass-fed dairy, and there are also plant-based options too, like cashews and almonds, spinach, asparagus, pumpkin seeds, and dark chocolate. Beta blockers, calcium channel blockers, and ARBs have been shown to reduce coenzyme Q10. Coenzyme Q10 acts as an antioxidant and is critical for muscle health, and the heart is one of our most important muscles. CoQ10 is needed to create energy in all of our body's cells. It can lower blood pressure, reduces platelet stickiness to discourage clots and strokes, provides immune and cognitive support. So if CoQ10 can lower blood pressure, and some blood pressure agents can deplete CoQ10, a supplement might be recommended. Remember, always talk to your healthcare provider or pharmacist before starting any supplements. CoQ10 deficiency can lead to physical and mental fatigue, difficulty concentrating, memory lapses, mild to moderate depression, and irritability. Chronic pain is also common with a CoQ10 deficiency, with frequent headaches or migraines, muscle and joint pain, and an increased risk for developing fibromyalgia. Deficiency leads to a weakened immune system, which makes people more susceptible to cold and flu viruses and chronic dental infections. The increased inflammation that can come from a CoQ10 deficiency can lead to high blood pressure, high cholesterol, and heart failure. Calcium channel blockers also deplete vitamin K2. Vitamin K2 promotes heart health by decreasing inflammation and preventing calcification of the arteries. It improves bone health by binding calcium to deposits in the bone. Promotes brain function by correlating with lipids in the brain and prevents age-related neurological degeneration that can lead to Alzheimer's disease. It also has been shown to help with anxiety and depression. Vitamin K deficiency can show up as an increased bruising and bleeding, since vitamin K is a clotting factor that is typically made by our gut microbiome. A vitamin K2 deficiency can also create reduced bone mineralization and an increased risk for developing osteoporosis. If you ask about food sources of vitamin K, many people think of leafy greens or broccoli, but these are sources of vitamin K1. Vitamin K2 is actually produced by bacteria. So some plant-based food sources for vitamin K2 are fermented foods, such as natto, which is a fermented soybean dish, or sauerkraut. Some other sources of vitamin K2 are cheese, beef liver, chicken, butter, and egg yolk, but these foods tend to increase the risk for heart disease, so would not be recommended, especially just to replace vitamin K2 in your body. A supplement is usually recommended if necessary, but again, always consult with your pharmacist or physician before starting a dietary supplement. Hydralazine, the direct-acting vasodilator, can also deplete coenzyme Q10 as well as vitamin B6. Since we just focused on CoQ10 with some of our other blood pressure medications, let's look at vitamin B6, otherwise known as pyridoxine. Vitamin B6 is essential for protein metabolism. The amino acids, the building blocks of protein, are found in muscle tissue. Again, the heart is one of the most important muscles in our body. Vitamin B6 is also important for cognitive and immune function and maintains cardiovascular health. People with a vitamin B6 deficiency can have microcytic anemia, which means the red blood cells are undersized. Skin conditions, depression, confusion, and lowered immunity. Some food sources of vitamin B6 include fish and organ meats. Plant-based sources are potatoes, chickpeas, avocado, sweet potatoes, bananas, and sunflower seeds. Now let's talk about some other foods specifically for high blood pressure. Here are some tips on blood pressure and nutrition. Unleash the power of vegetables by having half to 3/4 of your meal as vegetables. Pivot your mindset to focus on the vegetables first. Eat the rainbow. Choose a variety of vegetables in different colors. Utilize the DASH diet. I'll explain this in a minute. Eat whole grains. Reduce consumption of flour, sugar, and processed foods. Remember, gluten can damage the intestinal barrier and cause leaky gut and systemic inflammation, which can cause damage to the blood vessels in the heart. Eating too much sugar can raise blood glucose levels, also damaging the blood vessels. Probiotics can help to heal the gut and reduce systemic inflammation. Choose a quality probiotic to maintain a balanced gut health. Also, incorporate more functional foods for heart health. Okay, well, let's talk more about the DASH diet. DASH stands for Dietary Approaches to Stop Hypertension. This is an eating plan based on research studies sponsored by the National Heart, Lung, and Blood Institute that has been found to significantly reduce blood pressure. The basic overview of the DASH diet includes eating vegetables, fruits, and whole grains, eating fat-free or low-fat dairy products, eating fish, poultry, beans, and nuts, limiting foods high in saturated fats like fatty meats, full-fat dairy, and certain oils, limiting sugar-sweetened beverages and other sweet treats, and limiting salt intake. Based on a 2,000 calorie diet, DASH recommends 6 to 8 servings of whole grains, 6 or less servings of meat, poultry, or fish, 4 to 5 servings each of vegetables and fruit, 2 to 3 servings of low-fat or fat-free dairy, 2 to 3 servings of fats and oils, and less than 2,300 milligrams of salt. DASH also recommends 4 to 5 weekly servings of nuts, seeds, dry beans, and peas, and 5 or less weekly servings of sweets. Personally, I think eating 6 to 8 servings of vegetables and 4 to 5 servings of gluten-free whole grains is better for everyone's overall health. I'm also concerned about low-fat or fat-free products because they often substitute sugar for fat in order to preserve flavor. Fat carries a lot of flavor. It's also good for the absorption of our fat-soluble vitamins A, D, E, and K. Balancing omega-3s with omega-6s provides many health benefits such as cognitive support, cardiovascular health, reduces inflammation, bone and joint health, and healthy skin, to name a few. So choosing the right kind of fats is important. The DASH diet recommends vegetable oil, but you would need to use caution here too. Soybean, canola, safflower, and sunflower oils can be highly unstable and inflammatory, as well as high in omega-6 fatty acids, which the standard American diet has in abundance. Olive oil and avocado oil are probably two of the best choices because they're rich in omega-3s. Nuts and seeds also contain omega-3 fatty acids to promote healthy balance. I would like to take a minute to introduce you to Dr. Dean Ornish. In 1990, Dr. Ornish released a study showing that coronary artery disease could be reversed, not just managed, by focusing on 4 areas: eating a whole food plant-based diet, physical activity, stress reduction, and having social support. These happen to be 4 of the 6 pillars of lifestyle medicine. The other 2 pillars are also important for high blood pressure and heart disease. The first is avoiding toxic substances like tobacco, and the other is sleep, which a chronic lack of sleep has also been shown to increase blood pressure. This is why I recommend a lifestyle medicine approach to reversing high blood pressure. All 6 pillars working together can reduce blood pressure, heart disease, and diabetes, and in fact can reverse it. Just some food for thought. Okay, so let's talk about some heart-healthy micronutrients. This includes omega-3 fatty acids, vitamin D, magnesium, vitamin K, potassium, coenzyme Q10, folate, nitrates, and certain spices. Some sources of omega-3 fatty acids include fatty fish like salmon, mackerel, anchovies, sardines, and herring. Plant-based sources include nuts and seeds like chia seeds, flax seeds, hemp seeds, and walnuts, and plant oils like avocado or olive oil. Some vegan omega-3 supplements are now being manufactured using certain types of algae. Some foods that contain vitamin D include mushrooms, eggs, and fish, like salmon, cod liver oil, herring, tuna. But the best source of vitamin D is actually sunshine. Getting 10 to 30 minutes of sunshine without sunscreen several times per week can help to replenish our vitamin D levels. Sometimes a supplement is necessary when vitamin D levels are low, or when it is harder to get sufficient amounts of sunlight, like in the wintertime, working indoors, or for elderly patients. Magnesium is found in seeds, like pumpkin seeds and other squash seeds, nuts, such as Brazil nuts, almonds, cashews, and hazelnuts, grains like quinoa, brown rice, buckwheat, as well as okra or brewer's yeast. As we discussed previously, vitamin K is found in broccoli, cabbage, turnip greens, spinach, asparagus, green beans, oats, fermented foods, and eggs. Potatoes, legumes, leafy greens, bananas, avocados are good sources of potassium. Coenzyme Q10 can actually be found in animal products like fatty fish or pork, as well as plant-based options like brassicas, broccoli and cauliflower, spinach, and legumes. Folate is found in legumes, almonds, asparagus, eggs, walnuts, leafy green vegetables, citrus fruits, and brassicas like broccoli and Brussels sprouts. Let's talk about nitrates and nitric oxide. Nitrates and nitric oxide increase blood flow, relax blood vessels, decrease blood pressure, decrease plaque formation, and are anti-inflammatory. Foods that are a good source of nitrates include arugula, cabbage, garlic, beets, and pomegranate. Pomegranate is especially important for heart health. It has been shown to reduce blood pressure, plaques, and blood vessel wall thickness. There are even some spices and seasonings that are heart healthy, including garlic, ginger, and turmeric. Here's my list of resources for this presentation. Thank you for watching this presentation in my series, Medication Class, The Pivot Perspective. I look forward to sharing more information with you in the future. Feel free to subscribe to my channel. If you're looking for more information on this topic or other topics now, you can check out my website, www.dramynaprick.com. I write a free weekly blog post on a variety of health and wellness topics. You can also follow my Facebook page or follow me on LinkedIn, Instagram, or Twitter. Thank you again, and remember, food is medicine.